I still have to read much of that.
I was trying to understand it a little bit.
You mean?
I like the first question.
Did you see this
Yeah,
one?
oh, I don't know. That's a good question. Could we speak right now?
Probably because
it's not relevant until.
You on the board right now, right? You're out. That's awesome.
Did you get all the papers? You gotta sign in and get all your packets.
Well, I didn't sign it either.
Okay, you do.
Honestly, congrats to
you need, oh, here.
What are you trying to tell me, Maria?
What are we doing here?
This is a football game, right?
I was like, I was like,
Good, how are you, sir?
Are we?
isolation is over there.
We-
Unless there's a lot of discussion. It might not be approved.
What is Rotary? Oh, they use that.
Okay, so let's wait and see if bylaws are approved. At least you can do it. You can- So, it's right here.
I don't know if they pay.
Look at the new kids. First day of school.
Are you ready, Christina?
It's ready for you. It's live now.
Okay. All right. We're gonna call the meeting to order. It's 6:01 PM on February 7th, 2024. We're gonna start with public comment. I know we have at least one person appearing by Zoom from the public. And we have one public member behind us. You're gonna stay back here today?
Well, there's not, I can come, okay.
I know
Next time we're gonna set the.
You guys have a full board now, so it's FCC, so I wasn't sure.
I had some pokey before, and maybe you don't know what pokey is.
Onion, does it have a lot of onions in it?
Yeah.
Yeah.
Yeah. All right, so is there any public comment? No public comment, okay. Approval of the agenda. Update the next meeting on the agenda. Where's that?
The bottom of the agenda,
Yeah.
Second page.
where it says we're still in the library.
Oh, yeah, we'll do that. Yeah, we can do that at the end. Or is that, oh, that's in the agenda. Oh, I'm
Because we're
sorry.
approving the agenda.
Okay, yeah, I'm sorry. So the library is no longer available. So we're gonna, in West Sacramento for our next meeting on March 6th. So we're gonna change the location of the next meeting to the West Sacramento Police Department Community Room.
Do we have an address for that?
500 Jefferson.
500 Jefferson. All right, anything else on the agenda?
I'm so sorry, I'm slow.
It'll come, we'll send you
Oh,
notice. We're just for purposes of approving the agenda. Any other changes to the agenda? All right, I'll entertain a motion to approve the agenda.
So
Second.
I think it was Robin.
Yeah.
And then Sarah, Sue.
anybody else?
All in favor, say aye.
Aye.
All opposed? Any abstentions? All right, it passes. Approval of the minutes from January 8th. Are there any changes or additions or edits to the minutes?
We had a change requested from Linda White, and I'm going to make an adjustment to the section under correspondence to change the wording to read letter from Linda White included with the agenda packet for tonight.
Okay.
So that's the wording I'll change. So I
Thank you,
can
Christina. Any other changes? Can I get a motion to approve?
So moved.
Chris makes the motion. Second?
I'll second.
I'm sorry. Joe seconds it. All in favor, say aye.
Aye.
Opposed? Abstentions?
do I need to abstain? So I wasn't-
It's your choice.
I'm saying.
I'll just say aye, it's fine.
Okay, so we have one abstention and it's Robin.
Wasn't here.
Get that, Christina?
Got it? I got it.
You're on it.
Okay.
All right, so we have some new members. We have Margaret.
Meg, actually, thank you.
Meg.
Sorry, I don't
Sorry.
answer to Margaret, so.
Okay.
People call me that, it's kind of embarrassing.
Well, you did.
Well,
Okay, all right.
Thank you.
Do you want to introduce yourself and tell us a little bit about yourself and why you're here? And
Thank you, Jonathan. Yeah, I appreciate that. I think like most everybody here, either you have a passion around mental health, either because you've experienced it or a profession or you know a loved one, and I check all those boxes. So my journey started with my mom, who was suffered from bipolar disorder since far back as I can remember. And then unfortunately, she ended up with schizophrenia late onset in life, which then we ended up in the 5150, 5250, then multiple hospital admissions. She was down in Southern California and we were up here. It got so bad that the district attorney said, we're gonna suggest an LP conservatorship. So we ended up bringing her up here. We wanted a least restrictive option. And so we had her up here for a few years and we did the same cycle. And so eventually we did get her conserved and we were able to get her stable and with treatment, and she had a better quality of life than we could have ever imagined. And it was really a lot of the help from friends of Yolo County, all the mental health professionals. And so I really have a lot of passion around that and for families that suffer through this. So that's partly why I'm here. The other is my profession. I've been in healthcare for a gazillion years. And so I've seen the other side of it too, with how our ERs get impacted, and how mental health also impacts everything else with us, holistically. So I'm grateful to be here and I look forward to, jumping in with all you people because you do great work. And so I'm just excited to be here.
we're excited you're here. Thank you. Donna and Teresa, can you hear us? Excellent. All right, Kimberly Mitchell, Kim, do you want to introduce yourself? I know Kim has been to a few of our meetings and spoken, so.
No, I actually go back to Kimberly.
So, wait, so,
Okay,
Wait.
that's my fault, because I call you Kimmy, and he asked, and I said Kim,
I have
so.
Yeah.
separate, like.
so after I
but-
messed up with Meg,
No,
I'm
I
like,
get it.
Christy, does Kimberly go by Kim or Kimberly? And she said Kim.
I did, but
Kimberly,
I
sorry.
can't win. I love it.
okay. Want to introduce yourself?
Sure, my name is Kimberly. I've lived in Davis for about 10 years. I first came up to the area to go to school at UC Davis, and I ended up staying after I graduated because I really love the community. My involvement with mental health is primarily as a consumer. So then kind of experiencing the public mental health system from the consumer and peer perspective, like on a lot of different levels. So I'd say I'm pretty familiar with the crisis mental health system and the public mental health system locally and also throughout California due to my own experiences. I also have experience with the mental health system through my profession. So I've worked as an EMT and also as a wildland firefighter. So I've seen kind of crisis mental health from the first responder perspective as well. And that's kind of what I'm coming here with.
Excellent, thank you, Kimberly. All right, so we're going to move on to item 5, and we're very honored and I'm thrilled to have Teresa Comstock here virtually. Teresa is the Executive Director of the California Association of Local Behavioral Health Boards and Commissions. That's our statewide association. I'm actually an advisory board member, so I've gotten to know Teresa over the last, 9 months to a year, and she does an amazing job in leading that group. She is the former chair of the local mental health board in Napa County. And so, Teresa, do you want to expand a little bit on introducing yourself and then get started to talk to us about local mental health boards and our role and the committees and different things like that? Thank you for coming.
Great. Yeah, thank you. I really appreciate the opportunity to talk with all of you. So I want to introduce the association, just talk a little bit about our association and why we're here, and then have a training prepared. Is it an hour that I have or?
Yes.
Okay. All right. So California Association of Local Behavioral Health Boards and Commissions is a very long name, and we have a lot of members. We have 59 boards and commissions, and they're all similar to yours, where they are there to provide recommendations to their behavioral health director and to their board of supervisors. And they are made up of people, at least 50% are people with lived experience of mental illness or family members. And so I'll talk a little bit about membership requirements in a little bit, but most of the people on the board are volunteers, except for the board of supervisor member. So I wanted to show you the statewide board that we have, which Jonathan serves on. These are all members of one of the local boards or commissions in counties in California. We try to show the diversity of the state with our statewide board and try to model that for you as a local board, something that a lot of boards struggle with. So just wanted to get this in front of you just to see, we have a variety of race, ethnicity, culture, age, and experience among our board members. And really pleased that Jonathan is serving as well. He's helped quite a bit lately. He was just on a panel for us regarding criminal justice. So I'm going to move to the training, and you're all welcome to stop me and ask questions as I go along. The topics that I'm going to go through are membership, meeting rules and conduct, duties and tools, Mental Health Services Act, and just basically how to review and evaluate. And keep in mind throughout all this training that you are experts in your own experience. That's why you're here. And that needs to guide any kind of advising or recommendations that you make. Let me actually change my screen to present mode. So for membership, as I mentioned, 50% people with lived experience of mental illness. That may change if Proposition 1 goes through, and it will be people with lived experience of behavioral health issues, either alcohol and drug or mental illness. 20% consumers, 20% family members. You can go over that. That's a minimum. And then 1 board of supervisor member, 1 veteran or veteran advocate. And a veteran advocate could be just a family member or somebody that advocates. It should reflect diversity. And I mentioned that before when I showed you what our statewide board is made up of, something that we can provide advice on in order to increase diversity. So you should be representing your local client population. Individuals with experience and knowledge of the mental health system, and we have a long list of those, just anybody that intersects with the mental health system, and there's lots of sectors that intersect. All right, I'm going to go on to the next slide. We have a guide for the Brown Act rules. I'm not going to go over it tonight, just in the interest of time, unless there's some questions around the Brown Act. Just keep in mind, because I think maybe you have at least 1 new member in the room, maybe 2, that this is something that is important, and that you need to, follow the agenda, make your meetings as open to the public as possible, encourage the public to come to your meetings, and make sure that they have a chance to speak and address your board. That's just a big part of what you do. You're a public board, so you need to be open to the public. There are some allowances that are put in place to help the members if they want to be remotely connecting into meetings. Some counties have decided not to use those, that everything is just in person, because there are lots of hoops in order to use the allowances. But sometimes people do use those allowances too, so that they don't have to put their own physical address on the agenda. Any questions on the Brown Act before I move on? I could talk a lot on that. Okay. All right, so conduct. In some counties, we spend a lot of time on this slide. I won't tell you which ones they are, but so we start with active listening, and we mean listen, listen, listen. A lot of people, they react, and that stops the listening because they want to get to their turn so that they can react to what they just heard. We know that you're going to continue meeting month to month to month, and you might have some committee meetings between times to discuss items that you learned during your meetings. So you may be hearing different points of view. Maybe sometimes they agree with yours, sometimes they don't. But you need to let things settle in and listen to the public, listen to each other, listen to the staff, listen to the contractors and providers as you discern, how to make recommendations. Focus on issues. When I talk about issues, I mean something that you can make recommendations around. When I think of issues, I also think of, compare them to a problem. When I think of a problem, it's too big usually. Something like homelessness. You can't just go after homelessness and make a difference. You need to break it down and find areas where you can make changes. That's what I think of when I say issues. So one of the issues that you could be working on is, trying to increase stable housing for the people that are served through the behavioral health system, looking for the programs that are working and then scaling those so that you can increase those types of housing for people. Person first language, that means when we talk about people with mental illness or addiction, we use person first. So an individual with bipolar, a person with schizophrenia, people with mental illness, people with substance use disorders. Just realize that helps us realize that there's a lot more to a person than one aspect of them. That would be the way to treat everybody with dignity and respect, and realize that we all have a lot of aspects to ourselves, and one illness doesn't define a person. That could be just one aspect of a person. No swearing, no personal attacks or criticism. We don't go after people, we go after issues. One person speaks at a time, no sidebars, no whispering among people. That can be very distracting to the people that are speaking. And if you have people that come and address your board that have heavy accents, that's not the time to start checking your cell phone. That's the time to really, look up, make sure you're trying to understand what they say. Keep your comments short if possible. Do not monopolize. I haven't noticed that in your group yet, but sometimes the boards have individuals that take up quite a bit of time, and they need to be reminded that we'll meet again. So try not to monopolize so you can get through your meeting. Limit acronyms, anything that includes MHSA. Some of your new people may not be familiar with a lot of the MHSA terms. So that's Mental Health Services Act. And, whatever it is, you need to ask the staff if they're presenting and try among yourselves to spell it out or say all the words. And then silence your cell phones. I know some people need to check their cell phones for personal reasons, or sometimes just people have anxiety, so they tend to look at their phones. But for the most part, most people, that applies. Are there any questions on conduct? Okay. All right, so we're going to get into the duties of the board. And throughout this, I want to kind of point out some of the tools that you can use. These are all duties in California law that you as volunteers are mandated to do. So number one is review and evaluate the community's public mental health needs, services, facilities, and special problems in any facility within the county where mental health evaluations or services are provided. That's anywhere that's public. That could even be a jail. I don't know if that's something that you've thought about, but a lot of counties have reached out, and some have been successful in even going into jails to do site visits because they have mental health services. Some of the tools to use, and I think one of the things that that sparked the interest in having a training was understanding how to use committees. Some of the tools to use would be speakers, panels, and community forums in reviewing programs, liaisons to other commissions and committees, site visits, and then I put on this slide ad hoc committees because I think that's a good way to do research when you really want to understand an item better. And we have a handbook called Best Practices that provides some guidance on ad hocs, even a form to fill out if you want to make sure that you're not outside of the Brown Act. Ad hocs do not have to abide by the Brown Act as long as it's a short-term subject matter and less than a quorum that are participating on an ad hoc. I noticed that your board has a few standing committees, and those do have to abide by the Brown Act. I tend to ask or tell boards that standing committees should be limited as much as possible. You know, some boards only have an executive committee. A lot of times the committees don't need to be meeting regularly, so they could just become ad hoc committees and just form when needed. Performance outcome data is another way to be reviewing and evaluating. And let me,
I think we have a question, Teresa.
yeah, go ahead.
Good evening, Teresa. My name is Dee Oliveris. Thank you for taking the time to join us this evening. In your expert experience and opinion, how frequent would you say subcommittees would be meeting?
In my expert opinion, and I'm biased, I haven't seen a lot of counties with standing committees that are very functional. So, I think executive committees are fine. Some counties, they have a culture of having certain types of committees and it works for them. So, that's fine. But oftentimes it's just not necessary to have standing committees. Do you have a, specific committee in mind that you're concerned about?
I think that's a general discussion we've had in the past couple of meetings, one that I was not privy to attending. But I think in an effort to bring some organization to this existing and newer board members' understanding of how to be action oriented in the subcommittee space, how do we formalize that? What does that look like? What are the requirements? And then kind of decide amongst ourselves on how to bring those to action. And so far we have many thoughts. So I don't want to own the room on the discussion alone, but rather just kind of open it up to be intentional, not only with your time and input, but really get to the root of those discussions that have been carried over meeting after meeting. So we can kind of.
Okay. Yeah, with when you use the word subcommittee, to me that means standing committee, a committee that would meet regularly and meet throughout the year. Am I right? Is that what you mean by subcommittee?
Correct.
Okay.
We changed that provision in our bylaws.
It's to standing.
To standing, yeah.
With those, oftentimes, I would just say, look at the subject matter. Is that something that you do need to meet about throughout the year? Is that just something that at this moment you have people on your board that are interested in that subject? Could it be something that is short term, that you have a goal or an objective for that committee and that could be met and then the committee could stop meeting? Just think about that. You're always going to have different people on your board. You want to go with the energy that they have, not put into the structure of your bylaws, for instance, committees that, in a year or two from now, you're just not going to have members that interested in those committees.
Thank you.
Just a clarifying question, Chris Bulkley. We're doing our bylaws over again. So for the annual report, do most boards, is that like an ad hoc committee or is that a standing committee that produces that?
It's usually an ad hoc, or the executive committee just looks at them.
Okay.
Yeah.
So just one question, Joe Galvan. So it sounds like what I'm hearing is the ad hoc committees can serve the same purpose, but there's a lot more flexibility in the ad hoc committee because you're not working within the confines of the Brown Act and agendas and things like that. It gives you the room to maneuver, have discussion, and vary from that agenda if the conversation dictates it. Does that sound right?
Exactly, right. You can call each other, email each other, meet in person, have coffee, maybe create research meetings with people that you think could guide you without any of the administrative burden or the posting or, the Brown Act type rules that you have to follow with standing committees.
So it sounds like, and I guess I'm just saying what I think you just said, in your experience, that flexibility sort of lends itself to maybe a more robust discussion and a quicker resolution.
Right. I think so.
Thank you.
Right. And think about it, with any committee, you usually have one or two people that really, they'll roll up their sleeves and do the work. So, having that size, just a small group that meets to accomplish something, it often can be a good tool.
Thank you.
Sure.
Question. Meg Blankenship, I don't have a question around the committees. I have a question around the wording jurisdiction in the last slide. And where I'm going with this is that because Yolo County, you have Sac County and Solano County, and many of our residents do not receive care in Yolo County, especially if they're going to be an ambulance, they'll go to another, let's go to say Heads or Vacaville. I'm just curious when you say jurisdiction, how is if we know people, residents in our county are receiving care outside of the county? How is that data shared? Is it, local mental health board to local mental health board, or how is that? How do you recommend that is given some consideration, or should it be given consideration?
So in practice, boards often go outside their counties if they're being served out, if they have people outside their county at facilities. Say maybe it's the Synergy Board and Care in Sacramento. Then I would say set up a site visit. Just go out there and see where the people are yourself. You can connect, and I'm glad to connect you with the Sacramento board. I don't know if they've been doing site visits there, but they might be. So you could use, you could check with them if you don't want to do a site visit. But I would say just go ahead. Unfortunately, people are being placed outside the county, and that's true for a lot of counties. Did that answer your question?
It does, because they might be doing something better. That may be a gap, we don't know, but it's definitely impacts our community. So thank you.
I had a question about site visits. This is Sue Jones. Just in general, we're trying to start them up again. You gave us a lot of really good information, so thank you, and the stuff you sent over. But do you have any other tips, pitfalls to avoid, anything like that we should be thinking about?
Well, for site visits, just, for some people, they may have actually been a resident in that facility, or they currently are, and they're on your board. So I would stay away from that. Just make sure people are unbiased about the facility that they choose to visit. With site visits, it should be less than a quorum of your board. Usually it's nice just to have two or three people go for site visits. But I think that might be in the site visit guidelines that we provide in the best practices handbook.
Thank you.
Oh, sure. Okay, and then the last item I think on that slide was just around performance outcome data. And we've put, for each of the counties, we've put some data that we found related to the impact of the behavioral health services on the individuals that are served. In Yolo County, it looks like we need to do some updating, but we have some data that's pretty recent around your mental health court outcomes. And I know I think it was just a small amount of funding from the Mental Health Services Act goes into that, which are great outcomes. And then we have some information both on reducing incarceration, reducing arrests, reducing hospitalization, and think we have a few, we have housing also as a topic that has been collected by staff, showing really good outcomes in terms of the full service partnership type programs. And the AOT, it looks like as well. So this is an area where the state of California has been remiss. They have not standardized performance outcome data, so we've been advocating for that. And I think we'll see more and more standardization, so you can compare county to county for topics that you're interested in. You know, say you've identified that you need to do better with maybe school-based services. You can look at other counties and see what their programs are and what their outcomes are as well. We have all the counties on our website. And we're just pulling from reports that you probably see. Yes.
Teresa, this is Jonathan. We do have some more recent data posted, so that's accessible for you, or we can get it to you so you can update.
Okay.
That.
Yeah, I think since you're at the end of the alphabet, we haven't gotten to you. We're almost there.
Boosting by the time you get to YOLO.
On the second page.
I think you guys get away with stuff. All right, so let me go on to the next slide. Review any county agreement entered into pursuant to Section 5650. So California law is very complicated, and one thing points to another. When this points to Section 5650, it actually points to something called the performance agreement, which the county behavioral health director must sign off on this agreement with the state of California in order to get certain funding, like the Mental Health Services Act or the SAMHSA grant. SAMHSA is Substance and Mental Health Service Administration. It's federal grants. So ways to review any county agreement. Staff presentations and reports are always good, especially as they relate to data. And for Medi-Cal, there's something called External Quality Review Report, EQRO is what usually staff call it. And within that, it's a pretty long report. I would recommend looking at what are the recommendations that came from that audit. Usually that's just a page or two. And then what kind of performance improvement plans are in place in order to improve the Mental Health Services Act. You should be getting, of course, some reports from staff and updates on the Mental Health Services Act. And I'll talk a little bit more about that on another slide, the SAMHSA grants. And then if there are large RFPs or RFAs, which is request for proposal or request for applications, if the county's looking for new contractors for services, if it's really a large contract, they should be asking for your input and maybe get a couple or one or two members from your board to participate, looking at the applications and being part of the interview process. And then site visits. So that's another chance to look at contracts, ask the staff to view the contract, take a look at what are the deliverables that are required in that contract prior to the you are to advise the Board of Supervisors and the Mental Health Director. So when you advise, we kind of break it down into three areas. First, identify, listen to public comment, look at performance outcome data, again, presentations, and not just by staff, but maybe patients' rights advocates, other advocates and contractors. As I remember, you have a pretty strong NAMI group in Yolo County. I don't know, is that still the case?
Yes.
And then have liaisons to other groups, other boards and commissions and committees. So you could have members attend their meetings, bring back information that they learn, but also if you have maybe areas where you're really interested and maybe want to make recommendations or have made recommendations that intersect with other commissions and committees, that's a good chance to report to them or present to them. Research, again, the ad hocs. And in law, it says the chair should meet regularly with the mental health director. So that's a good chance to understand what kind of challenges or successes that the mental health director wants to raise. You know, your advisory board can be really instrumental in raising up some of the issues that are facing the county, and you could, you know, together collaboratively be approaching the Board of Supervisors if there are ways that the county Board of Supervisors could help. And then site visits for research. And then advise. So you draft your recommendations. We have in the best practices handbook just some advice on drafting recommendations and then vote on them as a board. So you're working together as a body to make the recommendations. And if the recommendation is made on the Mental Health Services Act on the approved plan, then and if your board approves the recommendation, then the behavioral health agency either has to implement that recommendation or they need to explain why they didn't take your recommendation. They need to explain both to the Board of Supervisors and to the California Department of Healthcare Services. Okay, as a public board, this is a big one. So review and approve procedures to use to ensure citizen and professional involvement at all stages of the planning process. So you want to make sure that the public is involved throughout. And there are a couple areas, especially the Mental Health Services Act, community program planning process is the procedures related to that. You want to ensure that they're reaching out to unserved and underserved communities and diverse groups and providers and people with lived experience and family members, you know, just across the board, and maybe going outside of their normal circles. The staff has a lot of requirements around this. And we know that people that are unserved and underserved often do not show up at community forums or government events. So there need to be ways to be connecting with maybe leaders of community organizations or church groups or tribal groups, you know, groups that would be natural to serve the people that need to be served. So again, we have lots of tools here, staff presentations, reports, attending public events. You know, your board members could be attending some of the Mental Health Services Act events that are open to the public, and review the plans and updates. Oh, there's also cultural plans that the county is required to do. So you could be part of reviewing that and making recommendations, you know, from your own experience and circles that you might have advice for getting into certain areas that the county needs to concentrate on more. You should be submitting an annual report to the Board of Supervisors. this needs to focus on needs and performance. And, for some counties, it's just one page, and oftentimes it's just one page that the Board of Supervisors will read. So, try to put your recommendations on the first page, maybe an executive summary. But it's also a chance to highlight the work that you've done throughout the year and show who your members are and what you do to help the community understand. Review and make recommendations on applicants for the appointment of local mental health director. So if the mental health director position becomes vacant, and you should be part of the process. So you should be reviewing, or you should have a couple members part of the process to review the resumes, to review the applications, and to be part of the interview panels. Review and comment on the county's performance outcome data. I showed you that already. There's a survey once a year from the California Behavioral Health Planning Council. Their acronym's close to mine, but it's a different organization. They're a council that their members are appointed by the Department of Healthcare Services. And so they're supposed to advise the state regarding mental health and behavioral health services. And one of the duties, this duty is we should be commenting to them on the performance. So you need to be able to look at the performance and then comment on it. And we've been CalBHBC, my organization, has been advocating to the Planning Council to redo their survey. Their annual survey for the last few years hasn't really had much performance information in it or chance to comment on that. It's valuable information, what they've been asking for. It's a lot around data and housing and children and youth. But I think in future data notebooks, we'll see more questions around performance outcome data. So I have a couple links on this slide, just to an issue brief that CalBHBC has done that's identified the performance outcome data for all the counties. And then also, I've already showed you the compilation on our website. This is just a snapshot of what's on our website. The main categories that most counties provide some performance data on right now are children and youth, criminal justice, employment, hospitalization, and housing. Okay, so that's not enough. You could have more. And I think maybe Yolo County, I don't know if you still do this, but a few years ago, or maybe it's several years ago, I was at one of your meetings and learned that you had an additional duty that was assigned to you by the Board of Supervisors, and that was to oversee the Public Guardian's Office. I don't know if that's still, is that still something that you do? Maybe not.
No.
Okay. So there could be extras. If the Board of Supervisors chooses, you could have more duties. And then you're also supposed to assess the impact of realignment of services from the state to the county. So in 1991 and in 2011, there were changes made. What was a state responsibility became a local responsibility. And the hope was that the funding would be there as well. That's still a question. But a way to assess the impact of the realignment would just be to ask, for presentations or ask questions around that when you're getting budget presentations, so you can learn how the realignment funding is being spent by the Behavioral Health Agency. But the agency does have to coordinate that spending with other agencies locally. And then there's the Mental Health Services Act. The role of the board in terms of the MHSA is to assure citizen and professional involvement. And we have a one-pager in the best practices document that defines what community program planning is and what the requirements are for staff and in terms of the participants and what the process should be. This is something that you should be asking for presentations on, so you know what is the plan. You can make comments and recommendations to just help the staff improve their process. Review and advise. I mentioned before that if you vote on a recommendation, it's called substantive at that point if it's been approved, and then a response is required either by putting into place in the next plan or update the recommendation, or reporting to the Board of Supervisors and Department of Healthcare Services why they did not take your recommendation. And then conduct Mental Health Services Act public hearings, so that takes place during your meeting. And then finally, we have a slide just to show some of the things to think about when you're reviewing and evaluating services. Keep in mind you're experts in your own experience, and we want that to guide you. But just put together some things to consider. Accessibility. Are the services culturally relevant? Do they work for different cultures, races, and ethnicities? You might see a lot of access from a certain culture, but really poor outcomes. So you know that maybe access is good, but the actual outcomes are bad. So think about that. Is it scaled? Is it integrated with other systems? Are things integrated with schools? Are they integrated with local clinics or hospitals? Criminal justice system, so many different areas. And are the programs communicated? Is it easy to find a program? Maybe on the website, maybe through advertising. Sometimes in communities you see big advertisements on buses and billboards. Sometimes it's just signage, when somebody has a crisis and they show up at a center and they can't find the room they're supposed to go to, things like that. It's good to be cognizant of that and make recommendations. Recommended practices, family and client and family driven. Peer providers should be an essential component. Clients and family members should be treated with dignity and respect and included in decision making. When you're on a site visit, you should be observing how is the staff interacting with the clients that are there. Program leadership and staff includes people with lived experience and family members, such as on nonprofit boards and as employees. That's something to be asking also during a site visit. And then evidence-based practices, we have a listing of some of those on our website. Trauma-informed practices are also on our website. And then something called community-defined evidence practices, which I think is new to a lot of people. And those are practices that work for different cultural groups that they've shown to be helpful to them. And oftentimes that's something that staff needs to learn about. We're actually, our association's going to focus on that at our quarterly meeting in Sacramento in April. That'll be online as well. So we're going to have a lot of different organizations who have community-defined evidence practices present and talk about how to increase that within your community. Sustainability, is it financially viable? Or are you seeing these programs close because it's not working, the financial picture? And how can the county help? You know, some counties actually hire consultants to help some of these new contractors get started, or they, you know, they pair them up so that the contractors understand how to braid the funding and make sure that they can operate and get new programs started. And is the workforce sustainable? Are there are there good wages? Is there enough support for staff? And then performance, of course, is for reviewing and evaluating. And I'll end with this last slide, just showing you some of the resources on our website. Any questions?
Sounds like we asked a lot during, so thank you, Teresa.
You're welcome.
And so any questions? Any comments from the public? Thank you, Teresa, for your time.
You're welcome.
All right, so I just want to, this sounds like a lot, right? So I'm really excited, like we're almost at full strength, this board, with some really, really great new members and the ones we already have. But I do have coincidentally some good news for you in terms of getting some support in some of the work we're supposed to be doing. And so I'll ask Carlene to talk about that.
Carlene Chakowski, mental health director. We've talked, I think, in prior meetings about as you all, I think, are refocusing on your bylaws and some of the expectations for local mental health boards, recognizing that some increased or layered support from the agency is really necessary in order to move that work forward, recognizing your roles as volunteers and on your own free time and the coordination that's really needed with Health and Human Services to get the data, information, contracts, those things. So this doesn't take away anything that Christina already does for the local mental health board, because she's an angel on earth and does an incredible job of coordinating these meetings, handling all the logistics, minutes, agendas, all of that, and she'll continue to do that. But to layer some additional support, I've met with Brittany Peterson, which anyone who's been on the board for a long time is familiar with Brittany. She used to have a different role with the local mental health board several years ago. She is an extra help employee with Health and Human Services, which means she works very part-time, but really actually has quite a lot to contribute. So she used to do the functions that Christina does now, so she's very familiar with how the local mental health board runs. She used to help coordinate site visits and other things like that. But more importantly, I think, than those pieces, since some of that is Christina's role, is that Brittany has a lot of skill and expertise around sort of her analytical skills. And she's actually in a manager level position actually with the agency, even just in her extra help role. Has excellent written communication, and I think will be very helpful to providing some additional administrative support to some of the work that you all have to do. So we still need to work out some logistics around that, like who she'll sort of get direction from, and a primary point of contact, so she's not getting flooded with requests, and that we're managing her work, because as an extra help employee, she can't work more than certain hours, so we have limitations on that. So we'll certainly have to monitor that, and she does do some special projects for the agency now, actually quite a lot with Incompetent to Stand Trial and some other criminal justice related mental health things, which she's been just a huge asset with. So Jonathan and I can work out those details and find a flow with that, but I'm very excited. Brittany was very gracious and willing to offer some support back to the local mental health board. She enjoyed the time that she worked with the local mental health board in the past, and so I think it'll be a good addition just to layer on some additional support from the agency. So hopefully that's good news.
Thank you, Carlene.
Yeah.
And does anyone have any questions on Brittany's role for Carlene? I've worked fairly extensively with Brittany and was on the board when she was the staffing it, and she's going to be a great help in addition to the work Christina does. Any questions for Carlene? All right.
Thank you to you and your staff.
Oh, yeah, of course.
Yeah, thank you, Carlene.
Yeah, thanks for
I'm going to go back to item 4, the chair report. We actually kind of rearranged some things on this agenda to get Teresa on the front end, but we forgot member announcements. So I'm going to put that under the chair report. I'm just going to ask for if there are any member announcements. Okay. All right. I'm going to move to item 6, bylaw review and approval link. I'm going to suggest, I was going to suggest, because we're short on time today, we've gotten back some of our time, that we not spend a lot of time talking about this, and if we can approve it with little discussion, we will, not taking away from any discussion we might have, but if there is, we would table this. But my suggestion is based on the report we just received from Teresa. We may want to, and this is a question for all of you, to have some further discussion and reconsider whether, we want to change the bylaws with respect to standing committees and maybe go to ad hoc committees. And I just want to, I know we've discussed this, I know we voted on it, but I want to put that to you. Would you all like to have some further discussion on it? Or would you like to move to voting on and approving the bylaws as is?
Jonathan?
Well, see, having worked on this since last summer, we thought, hoping we were done, because after listening to Teresa, I think we really ought to be moving towards more ad hoc committees and standing committees with all of the different Brown Act requirements, and really have a hard look at what standing committees we want, or if we want any standing committees, and make those types of changes to that one section. I think the rest of the bylaws are pretty much can be left to approve the way we've written them. But the standing committees really creates an issue for us.
Yeah, so I concur with that. A couple things that came up tonight really I hadn't thought about, and that was the flexibility of those committees to be effective under the ad hoc format. I think it's pretty clear to me as we've discussed it. So I think we warrants further discussion.
Meg?
So being new and just listening to this, it's kind of like drinking from a fire hose. So whether it's ad hoc or the standing committee, I'm not married to either one. I guess my question is, how do we get the work done? Yeah, like that's not clear to me. And so I'm happy to take this offline and you can, maybe I need more education, but it's not clear to me how we get the work done.
And what is the work?
And what is the work? Yeah.
And I wanted to circle back to Teresa and kind of ask that pointed question. I don't know if now's a good time because we're focusing on the bylaws, Jonathan, and I don't want to derail you, but I do want to get that question to Teresa in support of and in light of having newly appointed board members, kind of stepping back and really kind of understand from the start, how do we as a collective board step into action and where is that initiated from and what? And again, Teresa, going back to your experience, if I was a newly appointed chair, how would you onboard me and guide me into leading these board members to take on the work representative of Yolo County?
Right. Yeah, I think a lot of times, like once a year, a board will take some time to identify what are the top issues they really want to focus on that year. So you might want to have that conversation and just see what are the top 2 or 3 areas that people really have energy to look at. This, it could be things that come up during the year that guide that, but sometimes you just need to be intentional in saying, well, we really want to, we have people on this board right now that are very interested in a certain topic. Maybe it's school-based services. maybe that's an area that we could potentially make recommendations. So, yeah, setting what your priority areas are.
Yeah, are you saying, Teresa, that most boards, because it does sound like a huge amount of duties and work and assignments, are you saying that most local mental health boards don't complete all the tasks and duties that you just went through?
Oh, no, I'm saying you have to do all those, but I mean, you're going to be meeting once a month. And I also wanted to comment on the bylaws. Just keep in mind that the Proposition 1, if that passes, that will impact you'll probably have to do another update after that. So just keep that in mind. So you might want to just delay anyway.
Sorry, Chris.
I just wanted to comment on the standing committees and rebut, a little bit of what I've heard. We have been meeting as a standing committee, our program committee, and we do enjoy it, and it has been working. We've been meeting monthly since the summer, because we have things like site visits and trying to understand what programs we even have in our community. So I just wanted that for the record, that the program committee is functioning satisfactorily.
Yeah.
Well, and that's how you would recommend get the work done, right? I mean.
But I think you could have an ad hoc committee assignment for the program committee, what the topics are, and you wouldn't have to worry about all the Brown Act requirements and that component of it.
I literally asked that last meeting, and you naysay that.
Well, I didn't have the.
The key is it can't be, I mean, if the program committee is meeting continually throughout the year and beyond, then it cannot be an ad hoc.
You could have an ad hoc committee to do site visits for 6 months. This ad hoc committee will do organize site visits, organize a couple, and then you could reappoint a different committee. It's just kind of a structure.
Yeah.
So,
I mean, these are all good points.
I think that's precisely why we need more discussion.
Yeah, it is.
There may be a single committee that
Right.
the group says, you know what, this is one that needs to be here.
Right.
But it's probably not all of them, based on what we've heard today, and based on what we've kind of seen. We all have a perception of what the workload would be or what the things we should be looking at. I don't think that they all want that.
Right. So,
It seems to me like the standing committees, and correct me if I'm wrong, Teresa, but it seems like the standing committees are for deliberations because they have to be open to the public, whereas the ad hoc committees are more for the hands-on getting work done. So it might be that a standing committee would determine or recommend where we should go for site visits and things like that, but the actual coordination of them would be done by an ad hoc committee. The communications committee would say, in broad terms, this is what there should be in our annual report, but for the actual work where people have to get together and, roll up their sleeves, that would be more of an ad hoc committee. Does that gel with what?
Right, yeah. And yeah, if you have the programs committee is functioning and you think that it needs to continue throughout the year, that's okay. You don't always have to put these things in your bylaws. I say keep the bylaws as clean as possible and, have maybe something that says the chair shall appoint, people to committees as needed or something, but you don't, I don't think you need to put that type of thing into bylaws.
I guess, one of the things I was strongly for ad hoc committees anyway, so I'm all yay for hearing everybody say that now. So I'm awesome for that. But what I really think strongly, what I got a sense of from Teresa's presentation and kind of a lot of the ambiguity that everybody's feeling here, it really feels to me like maybe a really good ad hoc committee right now might be to do a strategic planning for us as a board. It really feels like we don't have a strategic direction and we're all looking for one. And I really feel like that's kind of what we're all seeking around here is how are we organizing ourselves? What is our strategic planning? I hear strongly that Christy's like programming. That's great. I understand that. That is a strong motivator for Christy right now and the people that are involved in that committee. But in a year or two, it's gonna have a little bit exhaustion because of the fact that we'll be reevaluating a lot of the same sites. And so we're kind of pigeonholing ourselves in that way. And so I kind of like the ad hoc idea still, obviously, but I really feel strongly that we might want to consider an ad hoc committee meeting for bylaws so that we can come up with a strategic direction. I don't mean bylaws. Sorry, Chris, sorry. I have mushy brain lately, so it's been a real problem, but I was thinking of how the bylaws turned into that. But for strategic planning, I really feel like we should be deciding, and everybody's looking for, what are the 3 topics that we're really interested in as a committee and as a board right now, that we're like, okay, this is what we want to come up with, and we want to come up with 3 goals that we can look at for our strategic planning. So that's just kind of my input here, because it really feels like everybody's seeking what are we doing and how are we doing it. And if we can come up with some more discussions about that and some strategic planning that's minor, just three topics of what are the things that we really want to focus on, then I think that would be a really good direction for us to go. So that's just kind of my input.
Teresa, is that kind of planning usually done by the executive committee, or is that usually done by a separate committee?
So that kind of planning, usually it's done, there might be like an ad hoc that kind of decides on like some of the prompts or how to run the discussion, but it would be, usually the whole board would be involved in that kind of decision making. You do find out what, where's the energy, what kind of issues really concern your board members. And then also the public, if it's on your agenda, you could be hearing from the public also what they would like you to be focused on.
So it's usually the entire board, not a particular committee.
It should be the entire board.
Yeah, what I've seen happen is you put up a big piece of white paper and write down everybody's thoughts and then let them vote. And first, the top 3 win.
I almost see the need as having like a board workshop to follow up by a strategic planning meeting, so that we can kind of workshop through what are we thinking, what are our targets, and then the next piece is really being very strategic about these are going to be our targeted areas, these are going to be our goals.
From a facilitation standpoint, like the format of having, obviously everybody would want to have input on that. And I think it would be really great then if the process for getting that done would be making an agenda item and stating that we're having an agenda item where we're having a strategic planning discussion, and giving it enough advance notice that community members can participate, and kind of like see what we're thinking about. I think it would get us far.
So why don't we do that at the next meeting?
I'm
Put
down
on
for
the
that.
agenda?
Yeah, agenda.
Okay,
Cool.
all right. Okay.
We need a motion for that?
I think we just did.
Oh, we need a motion for that?
Perfect.
No. No. Okay, so then I think we'll table the bylaw review, item 6. Are there any correspondence? None? Okay. We are 10 minutes ahead of schedule. Back to the mental health director's report. What items would you all like to pull? Oh, I'm sorry.
F.
Yeah.
F.
F. Okay. Sue?
And I was gonna ask for B and F.
Can you explain what you're?
Yeah, I'm sorry. I'm sorry. So this is sort of, I don't know if it's consent, but generally what we do is we have the report, which you have in the agenda, and then we ask for board members to tell us what items they want to discuss. So let's just say Robin said F, and Sue has said B and F. So when we all finish that, I will then turn to Sue and say, okay, under F, which is Senate Bill 43,
what are you interested in knowing about? Do you have any questions? What would you like Carly to talk about? Carly will then talk about it, we'll have a discussion, and then we'll move on to, the next one would be B. And then any other ones that people want to have Carly discuss. That make sense? Sure.
I just
Sorry
have a
about that.
question about E.
Yeah, okay, so I'll put E on it. Hang on a second, E. I'm gonna put D. Anything else? Okay, so let's start with B. Continuum of care. Sue?
I just wanted to check in on the local crisis or the 24-hour. Last time we talked, it was only a week old, so I just wanted to see how it was.
Yeah, thank you. Yeah, it's slow going still, right? Just in terms of quantity of after hours calls in particular. I mean, we certainly have quite a lot of daytime calls, which we have strengthened our existing system with our co-responders to add the ability to have a peer staff go out with them, or through telehealth to have a second person. So we are meeting the 2-person requirement and then doing the follow-up required. So we're certainly seeing a lot more contacts during the day. Actually, in my next mental health director's report, I anticipate I'll have some data that I can share. We requested data that we just got yesterday, close of business, but we need to kind of weed through it a little bit and clarify a few things. So the intent will be to share that with the board of supervisors, but also to share it with you all in my next report. There have been very few after hours calls. The first few didn't go perfectly, I'll say, right? So I'm being generous, but there's some kinks, to work out, and I think it's a bit of trial and error as we expected. And so we did have some successes though, so we certainly have had some positive outcomes so far, but we've really only had a handful of after hours calls so far.
Okay, and what kind of issues or what kind of kinks are you seeing?
Yeah, just our 24-hour access and crisis line, which is currently run by Heritage Oaks, but as you probably saw in the report, we've selected a new vendor through an RFP process, so we'll be transitioning. They've struggled with routing calls appropriately or responding appropriately to calls. We had one incident where local law enforcement called after hours to the access and crisis line to, access a mobile crisis response, and they were on hold for 11 minutes, which you can imagine for law enforcement is pretty frustrating, right? And then we had a situation where they were given incorrect information by the crisis line. So we are working on ways to circumvent that actually, and ideally actually allowing law enforcement to be able to call out for a mobile response directly, because we trust their perspective and their assessment of the situation. So our crisis team is working on formalizing that so that we can put some measures in place to streamline that process for law enforcement in particular. We are hopeful that with the transition to a new call center provider that we will certainly work through as many of the kinks as we can while we still have our current provider. But we imagine that many of these challenges will be very much improved when we transition to a new provider.
On the EMT, I'm just trying to, is that also part of partnering with AMR or other, having EMT be part of, there's the crisis line and then there's a team, right? And are we partnering with AMR, are they actually the crisis unit now?
Yeah, so they're the in-person response, so for after hours, for adults. So they are not answering the crisis line, they're deployed by the crisis line, right? And so they are providing the in-person response, and then we have a licensed mental health professional currently still available through telehealth, although we have had a person respond out, and actually they had to go out to the hospital because we did have to initiate a 5150 on at least one occasion. And we're working on having the licensed mental health professionals responding in person too. We're still working out some safety measures and working with our unions on side letters and other things like that. So AMR is the in-person response right now.
And so the EMTs that are trained for that, they're doing well.
Yeah,
It's
they've gone
different
through
way that they provide services.
Yeah.
Yeah,
absolutely. Yeah, so there's a required training in order for them to do it. So there's certainly more ongoing training that if this is going to be a long term, which at this point this is not necessarily intended to be a long-term plan for us. We're piloting this model. I think I shared in the last meeting, it's very costly to contract with AMR. It's not the most cost-effective model, right, for the long haul. And so we've committed to doing a pilot, looking at data and determining what the long-term model should be. But there was training they were required to do as part of the mobile crisis response through MTAC. And then our team has been doing or is doing sort of a CIT light with them to help sort of strengthen some additional training and orientation to the response. And I think so far that's been well received and it's gone okay. So that's sort of where we are.
Okay, I just want to make a couple comments on co-responders. I think it's the first time we're fully staffed.
Yes, it's a huge accomplishment for a long time. Yeah.
Yeah, that's great.
Yeah.
That is
Good
awesome.
job.
Good job.
Good job to our crisis.
Yeah.
And they really, I just have to acknowledge that the core team who was there, they really deserve a lot of credit and kudos because they were covering for multiple jurisdictions. Our crisis supervisor, Rob, was going out to cover for jurisdictions that didn't have a co-responder. And so they really all had a very heavy lift. And it is very nice to be fully staffed. But there's a lot of training happening right now. So we have new co-responders who are getting a lot of training, but it's very exciting. Yeah.
On the CIT, crisis intervention training, I know that, prior to last year, there was some concern about the training. I know that we had gone through COVID and there were other issues going on, but I feel like we've made a lot of progress. So that's really good. Those numbers look really good.
Yeah.
How does 2024 look right now?
Yeah, I'm not sure. I don't know if Sam knows about any calendaring for 2024.
So I think I'd be happy to speak to that. I know that there's been discussion about calendaring. We're actually in the process of recruiting a new position to assist our crisis team with coordinating all of those trainings. Because as you can imagine with the work that they're doing, providing crisis response, it's a little difficult to also figure out all the logistics. But we're anticipating hopefully being able to do, we'll be doing one 40-hour training before the end of June. And it looks like we're getting requests for even more than that. So we're actually hearing from UC Davis also, who's requesting some assistance and some CIT training from us. So we're looking at being able to incorporate that.
For the police department at UC Davis. So
They used to go to CHP, so.
yeah, so that's really wonderful. And we anticipate, as Sam said, being able to offer hopefully more when we have an outreach specialist sort of as a team, because it makes some newer folks wouldn't know this, but we've talked about this in the past year. We have one crisis supervisor who supervises all of our crisis clinicians, all of our peer staff who are doing crisis work, and other support staff for our crisis team. Also is coordinating and providing a lot of the CIT training, and it's just far too much for one person. And so in our 3-year plan for MHSA, Mental Health Services Act, we did add a position to help support that. So that could be with training, with also tracking and then helping with some of the materials, because we know that we can do some work to strengthen the materials that we're using as well. So we're very excited about potentially getting someone in that position to support the work. And we think we can probably do a lot more once we have a little more support for that, for the crisis intervention training.
And just so those of you who don't know, within the 3 local LEAs, law enforcement agencies, and Yolo County Sheriff, there's over like 300 officers. So imagine, making sure they're all up to date on the 8-hour, and then, a refresher for, veteran officers to do a 40-hour. That's a lot of training. So thank you.
Yeah.
And I think that's a great development with UC Davis. So as some of you know, our UC Davis chief is the former commissioner of the Highway Patrol. So with his connections, he was having, as Christy said, his officers do the training with the CHP. But with our new classes that have changed, he's now changing course, which I think is great because so much of our training is, YOLO based in terms of like what the resources are, presentations from our people with lived experience and from NAMI. So it's great that, their officers are gonna now be trained, with our program, so I think it's great.
Just to clarify, he's also the NAMI California Board President.
Would that also include the university officers?
That
That's
is,
what we're talking
that's what we're talking about.
Yeah, yeah,
UC
right.
Davis
Yeah,
PD.
just-
Yeah.
My understanding is they've also vetted an RN. They have an RN that's embedded with their.
They,
Yeah,
no,
with the fire
what they don't, I don't know if it's an RN, they use the fire department, so their co-responders
Is the fire.
is the fire department. It's a really interesting way of doing things.
Yeah,
So,
maybe they hired an RN. to
and I don't
create
think it's
that
even, I'm not quite sure it's even co-responding. It might be like kind of first responding when they don't need,
It's separate.
when they don't need police intervention, which most of the time, that's not necessary. Like, so in my view, co-responder is not the platinum model. The model would be, a crisis team that for the most part is not police unless they're needed. So UC Davis, the default is to send the fire department unless the police are needed. Is that right?
Yeah, in crisis, it's still the police who are really responding. Like the other responders are really for kind of like a lower level.
Lower level.
If that makes sense.
Yes.
Yeah, well, because
Yeah.
they're part of Davis still, so it's just interesting, right? Because yes, they're on campus, but I'm just curious if there is dialogue or discussion. So if they're creating this model, right, and they still service in Yolo County, is there a way to learn or,
I'm not sure how much of it there is yet, but that is.
Yeah, I mean, I don't know, I can speak for the Health and Human Services Agency, so I can say that we, in the last couple of months have had, I think, a positive meeting with UC Davis where I think we're working to develop, more collaboration. That's where we learned about their 24-hour crisis model that they were, and of course it's for much lower level crisis, but we hadn't been included. So I think there's a lot of opportunity for us to partner more and to align some of what we're doing. I think there's more interest in doing that now. And we've actually really sought some support from Supervisor Ferricks as well to help with that. And he's very supportive of that. So there was recently a 2x2x2, which is the city and the county, right? And I think there were some positive discussions there around crisis and working together. So we're feeling hopeful, that things will improve, But there's I think a long way to go,
No, but that's great. Gotta start somewhere.
Yeah.
That's right.
Just that anecdotally, like historically, there's been kind of like a disconnect between like crisis on campus, crisis in community, and then like disconnect between like the community and the services provided.
Right.
If that makes sense. Like there's no overlap, and then the agencies don't really interface with each other. So YOLO HHSA will interface with someone in crisis who is a student, but then there's no overlap communication or vice versa.
So that's great.
All right, so I don't know if my question for you would be under D or E, but one of them. I'm curious as to, there's been this slow but hopefully steady progress on outcome measures for Mental Health Services Act funded programs. How are we doing there?
Yeah, so it doesn't quite fit in either, but I'm happy to talk about it. I just want to say one quick thing about D, that we have confirmed dates and locations for West Sacramento, Esparto, Winters, and Davis for the community listening sessions. And so we'll get that information out to everyone. We're still trying to confirm the details for Woodland, but we have some great partnership with some of our county supervisors and their staff. And so I'll get those dates out to everyone, because I know you'll want to share that out. But it's mostly happening the week of February 26th. And it's each night of the week so far. We have the 26th in West Sac, the 27th in Esparto, the 28th in Davis, and the 29th in Winters. It looks like we may be holding the Woodland session the following week, but we're working to confirm. So once we'll have a flyer. I'll send it out so you can share it broadly. I just wanted to let folks know, and they're going to be held from 5:30 to 7 p.m. So regarding outcomes, so Eval Corp, who we're contracting with now, we are only contracting with them for the community planning process currently. I think as I've shared here before, we had not a successful partnership with our former contractor around evaluation. There was a lot of work attempted around improving our evaluation measures for the Mental Health Services Act. but it missed the mark in a lot of ways. And so we're going back to the drawing board in terms of what we would be looking for with a contracted provider. We didn't want to put out an RFP or engage in a contract until we're really clear about what we want, because those contracts can be costly and we want to make sure it fits. I think another sort of speed bump or a roadblock is also the pending potential changes with Prop 1. And so it felt a bit cart before the horse to then start developing outcome measures if we're going to actually have to change some of the programs that we're funding with Mental Health Services Act dollars, which is highly likely if Prop 1 passes. So we'd like to wait and see what's happening in March. In the meantime, where we were really lacking outcome measures is for our internal teams and our internal programs. So our internal teams have been working diligently on ensuring that those outcome measures are developed and that we're starting to track the data. I can work with Samantha and Tony to get an update from our adult system of care and our children's system of care for the next meeting. So I can certainly follow up on that to see where we are, because that's where we actually saw maybe the biggest issues with missing data or with having RBA, results-based accountability measures developed, which is the tool we use to measure impact of our programs and contracts. And so that's been the focus internally. So I can provide an update next time.
Okay. All right, so now we're on to external quality review. Robin?
I just want to, is that going to be a full presentation when the full report comes in?
Yeah, and it's interesting. I wrote a note as she was presenting saying maybe we should do a presentation. I don't think we've historically done that, but I made myself a note, I put presentation question mark, because I think we've usually just provided the feedback. We just had our external quality review last week, so this is a timely conversation. We won't have the report for a couple of months, but if it's the board's interest for us to do a presentation, Samantha and I would be happy to do that.
I actually made the same note.
So I'm really familiar with the EQRO processes.
Yeah.
And so like my thing is, I kind of like fold in with what Teresa was saying.
Yeah.
That I wouldn't say necessarily a full presentation, because that's really just kind of an overview of a lot of things that we already know.
Yeah.
But I'd really like to see the performance improvement measures suggestions. Because I think those are the things that we're going to be most interested in as a board.
Yeah, absolutely. And I think, I don't know what it matters now, but just in case anyone was curious, just to sort of say it out loud, Samantha most recently joined us, and she was the executive director of the EQR, right, of BHC. So certainly an expert around those measures and that work. And so I would love for her to join me in making sure that we're presenting you with valuable.
I would love it. I get really passionate.
She really likes it. So
there's some really exciting performance measure data that is available to us, and some analysis that we can share of some of the things that we're doing really well, and definitely some areas for improvement too, and then whatever recommendations they provide to us. So happy to do that.
It'll be around May, right?
Yeah, we're expecting
Usually
to get
about
the
3
final
months.
report around May, so I don't know if we want to plan, it depends on timing, but probably the June meeting seems most appropriate then, if that works with your timing in terms of, your long-range planning. Yeah.
All right, FSB 43.
And care.
And care, yeah. You're right, Robin.
Oh, I just wanted to hear updates and how things are going about that. It's a lot of work. So, like, I was just that was my take, was like, let's hear really how it's going.
Yeah.
I know
So,
Sue was interested in this one too.
Yeah, it is I have a specific question, but I'll wait until.
yeah, I think there are probably a few questions. Yeah, so
Before you guys go, Kimberly had a question from before.
Yeah,
Oh,
sure.
I'm sorry.
So, Eval Corp, so I attended their, sorry, kind of brain's kind of foggy. So then I know they distributed a survey.
Yeah.
And that was supposed to close this Friday. Is that still the date it's closing, or is that?
if that's the date, I'm not sure about the date. I can double check on the date if that's what they said it was closing.
Yeah.
Yeah, then that's when it's closing. So the survey, as I said in my update, I think we're getting feedback from a number of, in a number of ways, right? So one is through the survey, which has been distributed widely. I actually got a copy of the survey in the email blast from my child's school district. So I was like, there we go, that's wonderful. So everyone in the school district, every parent in the school district got it, right? And all the students are getting it as well. But so that's gone out very broadly. Actually, our probation partners just shared it as well, criminal justice partners. And then we've done some key stakeholder interviews, and then we're doing these community listening sessions. So with the survey ending, and then we're gonna head into the listening sessions at the end of the month. Yeah. Okay, SB 43 and CARE. So, yeah, I mean, we're just starting to get our feet under us and figuring out what we need to do. And so there's a few steps that we are either already taking or planning to take. So first for SB 43, I think just an important thing, I combine these into one update because there's a lot of overlap, right, between the development of the CARE Act model for YOLO and with the changes that are coming with SB 43. And so while we will likely have 2 work groups working on the work, there's certainly a Venn diagram here where there's overlap in the middle. So it's really important to coordinate that work. So for SB 43, our intention is to convene a local collaborative work group with all sort of partners who really need to have a seat at the table. And we are looking to some of the statewide work to help us sort of get our feet under us and to sort of plan out what that looks like. So there is a state level work group that's being pulled together now. Samantha's going to participate on behalf of YOLO, and that's specifically for the behavioral health side. The Public Guardians Association will also be doing their own work, and we'll certainly have representation there. And then at some point, there is an intention for CBHGA, so our Behavioral Health Directors Association, and the Public Guardians Association to work together. And so it is really important that there be some consistency across the state and how some of these criteria, definitions, and tools are being developed. But we also know that counties are moving at different paces. And then the last piece is that there are just a very small number of counties that are already implementing and learning some very difficult lessons already, unfortunately. So I've heard from, I chair a medium counties group for CBHGA, and San Luis Obispo is definitely having some challenges already in their implementation. So we'll also get to learn from counties that took the leap and started implementing right away. So that's our plan. And as you saw in the report, I try to do my best to include, and this shouldn't be considered a comprehensive list, but at least at sort of a first pass, our best guess around all of the things that need to be developed. And some of those things probably more collectively by counties at a state level, but certainly locally as well, in order for us to be able to implement SB 43. So we anticipate that our work group will get started here shortly. In the next few weeks, we'll sort of start convening, getting folks notified so we can get some dates on the book, and we'll start meeting.
Can you refresh my brain? There was no money attached to this, correct?
So there are $0 specifically to SB 43 at this point. There is some funding that is tangentially sort of connected maybe to some pieces of this, but not really, right? So there's I think what the governor will say is that there's a lot of money in behavioral health, right, statewide, and that some of those dollars should be supporting some of this work. For CARE Act, I can speak to that a little more specifically, but for SB 43, at this point, there are $0 attached to the implementation of the bill. So the biggest gap for us is absolutely in our Public Guardians Office and in our staffing. We are already very short-staffed, carrying much higher caseloads, and I think the intent is for us to do a presentation from the Public Guardians Office next month for you all at this meeting. And we need more staff just to handle the workload currently, and we certainly will need additional staff to implement SB 43. So that's the biggest gap, but there are impacts to behavioral health as well. And then there's a whole other piece of this around the kinds of facilities that are needed to place people that don't exist currently. So lots of work to do there. And I think some of the hope is that, if I'm channeling the state and our governor, is that if Prop 1 passes and the bond measure passes, then there's a lot of housing infrastructure dollars, but they need to be built and created and stood up. I believe that the hope is that money can support some of the placement needs that we'll see with the implementation of SB 43.
Sue?
Yeah, I don't want this question to sound too pessimistic, but it's an incredibly complicated program. It's got a lot of interlocking parts. It's new. and involves civil rights issues. And I'm just wondering, I mean, even with everything you're doing to make sure that nothing goes wrong, things are going to go wrong. So are you also looking at like, I mean, it's great that the county did that website so that it's easier to make complaints now and you've got that more of a process now. But on the back end, are you going to have the staff in place to investigate those complaints and the civil rights investigator?
Yeah, I mean, you bring up a good point, and it's certainly not something that we've thought about or talked about specific to the implementation of SB 43. I will say, as a Health and Human Services agency, we've been trying for actually several years now to fund a position to investigate complaints about rights violations and complaints in general. Do you want to share an update about this? Because Tony's done a lot of work on
We're continuing
this.
to work on developing a position that would be a permanent position that's funded and as just part of the infrastructure. But we've been working with an ad hoc role, someone who's assigned from the county council's office, right? So we have a specific individual within the county council's office who the complaints are routed to that individual who then has the authority to look into them, kind of walled off from their responsibility as county council. And they're able to act as sort of an independent third party. And so it's the model that we're currently using, that we're hoping to leverage the experience from that model to sort of inform what we'd like to do long term. So I think in this next budget cycle, it remains to be seen, whether or not that position would be funded. I know we requested last year and it was denied. So I'm assuming, I can't confirm one way or the other, that if the position isn't able to be funded, that we could continue with sort of this ad hoc role that we currently have. But I can't say one way or another if that would or wouldn't happen. What I can say is that it's been good. Maybe that's just a little bit too simplistic, but it has really, I think it's been beneficial for not only our clients or citizens who want to make a complaint, but it's also been good for our department, because then it gives us some ability to stand back. So previously, complaints would come to us and we'd be doing like an internal investigation, and there was always some sort of question about, are you really investigating this seriously, right? And so this provides us with some level of, we have an objective third party who is looking into the matter. So.
And just to clarify, I mean, that's primarily around our social services programs too, because for behavioral health, we have very specific grievance processes that are followed and that are managed by our quality management unit, which is quite separate from our providers and our actual service delivery staff. But the intent of this position is to really bring to strengthen the way we're able to respond, particularly to social services complaints, which public guardian, while there's behavioral health components, right, to the services, that is, maybe falls under more of a social service function in some ways. So I hadn't really thought about it in that way, but I certainly think it could strengthen our need for that position even more. Yeah, thank you.
I have a question on that also.
Yeah.
The county opted to wait until January 2026, but the definition for gravely disabled under SB 43 adds inability to provide for necessary medical care and or personal safety. Are we applying that expanded definition just for the mental illness side, which is still in existence? So if we're looking at conservatorship, we're looking at those elements also on top of the providing food, clothing, and shelter? Or is that those added aspects of the gravely disabled will wait until January of 2026?
Yeah, I mean, so in terms of when we actually launch, right, I think what the board chose to do was to defer implementation to January 1st, 2026. There's nothing that precludes us from going back to the board and saying, we're ready to launch in June of 2025, or we're ready to launch in March of, so I mean, but yeah, I think as I've laid out here, there are only certain pieces that went into effect right away, and some of those are around sort of more of the legal processes, but the changes to the definition around gravely disabled are all part of the work we need to do to prepare to implement.
So right now, they're not set to go into effect for 2 more years.
Okay, because you
At
have
this point,
the
yeah.
substance use disorder component, but when you're looking at gravely disabled for the mentally ill, the definition is looking at food, shelter. It's not looking at the ability to be safe, provide medical care. But SB 43 adds those factors into that consideration not just for the substance use disorder, but for the existing individuals who have a mental illness.
Right, which is why it's development of a standard definition of that needs to be created, because there isn't one currently. And so while saying it in SB 43 is great, there is no standard definition or criteria for what that means. So that's what needs to be.
Because you're not gonna need another program for those individuals, because the treatment's gonna be the same as what you already have. But if you, I'm assuming.
It depends on their level of medical needs, because many of our boarding cares and placements now don't actually have the capacity to meet some of the complex medical needs that we might see with this expanded definition. And so when I say that there are many facility types needed to actually ensure that there are facilities where folks who may be conserved under the new criteria can go, that's absolutely the reality.
Is it possible to have a staggered implementation, or is it kind of all at once?
So I think I can answer that.
Sure.
To
So
be determined.
I think for many people, including myself, although understandable that it was pretty much impossible to implement now, like some counties have done, and we're seeing issues, it was very, very disappointing, because for some of us, we thought SB 43 was taking us in a very positive direction in terms of changing the standards for conservatorship. And so my disappointment was, like, we're just like shelving this for 2 years, but we're not. And so that's the good news that I was really pleased to see, is that we're, starting this working group and we're looking at it. And so this board approval to delay does not necessarily mean we won't implement before 2 years. It just means that basically the board has said to HHSA, you have until this date. It doesn't mean we should definitely
So
wait.
it's possible then that certain aspects
Yes.
could be implemented?
Well, to be determined. Yes, it is possible.
Okay.
It is possible.
So we
It
could
is
have
possible.
certain parts, but not everything.
Yeah, because when I first heard about this, I'm like, so we're just like forgetting about this for 2 years, and that's not.
Well,
There's an incredible amount of work.
Well, I'm not saying there isn't.
I mean, if I can just say,
Yeah.
and this is, I'm probably just inserting some of my own opinions here, but certainly as the mental health director, but also as the public guardian for Yolo County, I think that it was entirely unrealistic to expect that in 11 weeks, from the time the bill was signed until January 1st, that any county could truly stand this up. There is one county I know of that implemented on January 1st, and the mental health director, as of last week, is spending more than 50% of her time each week writing policies and procedures, trying to catch up so that they have structures in place, because they're literally building the plane as they're flying it. And when we're talking about people's rights and around taking away those rights, my personal belief is that we have to do it as well as we possibly can, so that we can treat people ethically and that we can do right by our community, right, and by our residents. And so to Jonathan's point, it doesn't mean that we're going to sit and twiddle our thumbs until December 31st of 2025, because if we did, we'd be in a really bad place on January 1 of 2026. There's a lot of work to do, and we're getting those wheels moving, even though we have zero funding to support the work, right? So I just want to be clear about that there isn't anything to support it. And so we're going to put our all into it. Perhaps we'll be ready to implement sooner than that. And I certainly am committed to keeping this board apprised of our progress, and the Board of Supervisors apprised of our progress. And it's not just our progress, right? It's also our local hospital partners who also requested a deferral, because they are also not ready to have their emergency departments filled with folks that have nowhere to go, because there's no facility types for placement, and we want to make sure we're coordinating well together. So I think we all have the right intentions. I understand the disappointment and frustration, and I can't downplay that at all. I know that there's a lot of hope around what these changes can bring, and it's my job to make sure that we do this right. And so that's what we're intending to do. And there's a whole lot, and I hope this helped to capture just the tremendous amount of work that lies ahead for us locally.
I just wanted to understand better. So if I'm in the county that did adopt it
Yeah.
immediately, the definition of gravely disabled in that county, the legal
Yes.
definition is different than the legal definition in this county.
Yes, which
So
is
if I'm going around
problematic.
California, I
Yes.
don't know
Yes.
what.
That's very,
those are.
and that's incredibly problematic, and we did our best to talk about that at a leadership level, right, in terms of the mental health directors across the state, and the importance of more alignment around implementation dates, because we absolutely have people who go between many different counties, right, and we know that we have folks across county lines, but farther than across county lines, right? And so to have a different standard or definition at different times in different places is very problematic, absolutely problematic. So, and I think, I know that there are some counties that their boards deferred only for 1 year with the ability to go back with updates and to potentially defer longer if needed. Many counties deferred to 2026. I think that there needs to be more strategic alignment across the state to the extent we can. I'm only aware of 2 counties that implemented, and that's San Francisco and San Luis Obispo. Yeah.
All right.
Kim's had her hand up.
Oh, I'm
Yeah,
sorry.
yeah.
Go ahead.
So, I just wanted to clarify, like, I know this is really general and there's a lot of components to this, but overall, what does implementation look like? Is it kind of more on the criteria end, as in more people are getting put on holds? Or is there kind of more being worked on the, where people get set?
Yeah, I think all of that needs to be done. So none of that has happened yet because this just was signed, right? So all of that needs to happen. So for us locally, I think where we have to start is around the criteria and the training. We have to make sure that we have folks that we have a standard definition, that we have the information to train folks to those definitions. And I think the work around having appropriate facilities is much bigger than us locally, right? We have no dollars at this point to create new facilities. And so, so I think there's lots of work that needs to happen at a state level, right, to help assess that and really to regionalize those placements and services, because we don't have, some of these don't exist, period, across the entire state. So that's a problem statewide. But we also will need more boarding cares, we'll need more placements, and we will certainly need more funding to support that.
All right, so we've
The
got,
good news is though, by our next meeting, we will know more.
Yes, always know more, that's right. We'll know
By our
about
next
Prop 1,
meeting.
we'll know about Prop 1,
By our
that's for
next
sure.
meeting, it'll be clear.
yes, okay, so we're a little short on time now. I just want to ask if there are any public comments on what we've discussed so far. Seeing none, okay, so we want to try to move through this a little bit quickly. 'Cause I don't want to keep people extra. Oh, Linda, sorry, go ahead, Linda.
Thank you. I just want to give a shout out to the current public guardians and the services they provide. And I want to toss out a thought for people that are already identified as needing guardianship. As those people begin to have an opportunity to step down, but may not be ready, I still hope that there's some definition in place. We talk a lot about taking rights away, and I want to put out there the right for an individual to have his right to stay alive engaged. That's the most important issue for me, because when a person loses their capacity to evaluate cause and effect, in essence, their rights are being violated if they don't receive services through something like conservatorship. So I really appreciate the efforts that are being taken. It grieves me a little to hear about delays, because we already know we have a population in Yolo County that's identified that need those services to remain intact. Thank you.
Thank you, Linda. Okay, standing committee updates, budget and finance, Joe?
No, nothing.
Okay, communication and education,
Nothing.
okay. Program,
You're on. Me, appoint Sarah.
okay. Sarah Gaines is going to be appointed the new chair in place of Christy.
So Sarah's gonna give the report.
Okay, so we met and we came up with, well, actually, Christy came up with this draft, two drafts. One draft is a guide, a site visit guide, and a lot of this information came from the Cal BHP.
See,
Okay, I get it. Website, and so we've been going through this in our meeting, and what we need from you is to look through this site visit guide and also this facility program observation report, and we would like to discuss this and then have input from the board on suggestions or changes before we start to try to schedule some site visits for programs that we need to evaluate. And what we'd like to do is have any input or changes sent to me, and by the 23rd.
Through Christina.
Through Christina, yeah. So, right, the 21st? Yeah, I'm sorry, by the 21st, so that we can try to get this approved at our next board meeting.
Will Christina be sending out electronic copies of the documents?
They're on the website, our local mental health board website.
These are, okay. So, that's kind of where we are.
So is Christina emailing all of us and getting responses back? Is that how it's working?
No, if anyone has any feedback, any suggestions, they could send it to our committee and either directly to Sarah or Christina can forward them to us.
Yeah.
But, we would like to have all the feedback in by the 21st so we can come up with a revised draft to get it to Jonathan to make a request to put it on as an agenda item at the next meeting. So what we want to do is bring back a revised copy of both of these documents, the guide and then the actual report, and then a finalized list of site visits. So at the March meeting, it can be voted on and we can move forward. So I know, Sarah, you had a suggestion already.
Yeah, I suggested that we add a client interview to this form, because this form also, it really focuses on staff and program directors, but it doesn't have any input for clients.
So I don't
I think there might be confidentiality.
Yeah.
So these, just so you know, I use.
Well, on their website, they have a form that is, it's anonymous. So I don't know, would that be a problem for confidentiality?
Identify them. Yeah. Well, if it's a form, well, I mean, maybe we can talk this through another, but if it's a form that the staff member gives to someone and asks them to fill out, and then they fill it out anonymously, you don't know who it's from, then I guess that's anonymous. But if you're there and you're wanting to interview a client, then that's not anonymous, right?
Yeah.
So, right. Right. So yeah, I don't think that's, I'm happy to look at the document, so I can look
It's
it up
on
the account.
their website.
Yeah, I'll look it up. Yeah,
Okay.
yeah, I'm happy to look it up.
It's under the client interview, and there's an adult one and there's one for children.
And maybe we can, as a follow-up, maybe inquire from Teresa about how counties have used that, or, how other behavioral health boards have used that. But I'm happy to look it over.
An idea I had also is question 10 states, is there any other aspect of the program you'd like to share with us today? We could create a separate sheet that they could fill out ahead of time that was anonymous and they could turn into us, but that was my only other idea, is to tease out that question if we decided we wanted to actually ask a client. But these templates are from other county examples, and I just put them together to meet the needs of our county.
Any thoughts on this, Teresa? Or you don't have the?
Yeah, I think San Francisco may be the only county that does the program type site visits where they actually interview. And that was just because they had a member that had been a social worker that really, really liked to do that. I don't know, I don't think in practice it works that well with a lot of members. So, you know, it's up to you on how you take that information. My recommendation would be just to go with the suggested observation report that the committee has come up with.
So if we haven't done these in a while, I guess is there a cover letter, because if this goes out beforehand, I mean, I think we don't want to create it adversarial, like we want to be a partnering, collaborative, and I know that's the spirit of this. but
Oh,
it may
yeah.
not be.
Yeah, there's a whole procedure that we have to like iron out, but it would,
Because if we've not done it, people may be like, what's this? Why are we doing this? Like, so, because if the county hasn't done this before in a while, and I just want to make sure we're setting itself up for that collaborative.
well, and that's where the liaison role would come into play with this, and we kind of call that out in the.
Yeah, we would want to be able to help support that, right?
Right.
So we could help be sort of, the bridge to the contractor, to the provider. And yeah, I think, a couple would be wonderful, and so we're happy to help with that. So Brittany, I think can probably.
Yeah, we have we talk about an administrative liaison to provide lists and to contact the programs.
And I think if you're going to ER versus other services, like just different, and I guess the liaison could like tailor it to, right? Because there's just certain biases people are gonna have if they get these, like why are people coming? Is it gonna be publicly recorded? How is this gonna negatively impact me? So I just would hope the liaison knows to say, okay, in this type of facility, this is gonna be their concern. How do we make sure we address those? In this facility, it's gonna be this. Just so that the observers are they're really getting a great experience and getting everything that they ask for and not getting people like, I'm afraid to talk to you.
These reports will be public then.
Yeah.
Yeah.
And
So that's gonna be a big concern.
Yes, it
If there
is,
any
and that's
entity
exactly right.
having a visitor.
I think it's a great idea. I just want to make sure we set ourselves up for success.
So all this feedback is what we're asking for, so if you could
Yeah.
please pose it in an email so we can capture it. And
But I didn't know if Carleen had, like, if they have this liaison, maybe they already have this process.
No, it's been quite a while since this board has done site visits, and in just full transparency, what she recalled was like a visit to like the wellness center, so it wasn't maybe as much of site visits to contracted providers. So I am not sure when the last time we've sort of dipped our, toe into that water. So I think there's some things to work out there.
I think it's a great idea.
Yeah.
I think it's much needed.
well, it's in our welfare and institution code, so we have to.
Yeah, but even if we don't have to, I think it's a great idea.
Noted.
Just a comment on that, if I could. It's good to, after the report is provided by the folks that did the site visit, to have it reviewed by your executive committee and the behavioral health director or staff, and make sure it's ready before it becomes a public document. If there are concerns that need to be addressed right away by the department, that needs to happen by the department. Your role is to, look for information that could help you advise.
Thanks. All right, great work. Thank you.
Yeah, great job, Christy.
Yeah, great.
Hey, it's just a standing committee,
It's been great work.
It was easy. Thank you for all the wonderful examples. It really was a good resource. Thank you.
Okay, Board of Supervisors report.
I got nothing.
Okay.
Nothing to report. We're happy to host MHSA listening session, and we've been obviously liaisoning with Health and Human Services and making that happen. So we're putting it out to our media channels. See, now I remember. Sorry. We're putting it out to our media channels and also working with the city of West Sacramento to get the information out and hopefully get a good turnout for that event. So
Thank you. Thank you for coming. Criminal justice update, Chris.
Trying to be brief, the Department of State Hospitals grant that we have, they're now offering to make that permanent, and I believe we're going forward with that as a county. It's been a very successful program that takes individuals who are incompetent to stand on trial, as opposed to having locked up in a state hospital or jail for the jail-based competency program. It puts them into the community with HSA taking the lead and treating them. And so we've had a lot of really positive outcomes. And so that's really good news.
Diversion program. Yeah,
Mm.
it was
Awesome.
temporarily funded, but we just applied for permanent funding.
Yes. So that's good news. And then the Prop 47 grant, we're getting referrals now. And hopefully by the next meeting we have, we'll have people actually engaged in that work. And so that's focusing on substance use disorders.
Thank you. Any more public comment? Linda, Donna? Okay. All right, then I think we're adjourned. Our next meeting is March 6th. We all have homework
In West Sacramento.
in West Sacramento at the West Sacramento Police Department. Thank you. Thank you, Teresa.
Thank you,
It's at West Sacramento.
And I'm Zoe Barron.
At the library.
I'm taking my
Oh,
secretary.
yes, Chief Strange agreed to hook those up.
I didn't mean it. I'm sorry.
Oh, I wouldn't bank on that.
I know.